Hi, I'm Dr. Steiner, and in this video we're going to talk about peripheral neuropathy. Now, how to stop the pain of peripheral neuropathy? Well, first off, I am a doctor of chiropractic. I've been practicing for over 12 years. I've helped over 500,000 people. In our practice, the focus is neurometabolic health correction. So what is peripheral neuropathy? Well, peripheral neuropathy is a problem with the nerves that carry information to and from the brain and to the spinal nerves. This can cause pain, loss of sensation, and an inability to control muscles. This is very severe. Now, peripheral means further out from the center. So your toes are more peripheral than your kneecap because it's further from the center of your body. Okay? Neuro means nerves, obviously, and pathology means abnormal. So peripheral neuropathy means pain that is further from the body, further from the spinal cord in this case, causing nerve pain. So there's 7 signs of peripheral neuropathy. 1 is numbness. 2 is burning feet. 3 is cramping. 4 is sharp electrical pain. 5 is pain when walking. 6 is difficulty sleeping from leg discomfort, where your legs are in pain and burning at night. And 7 is prickly, tingling feelings. So the symptoms depend upon which type of nerve is affected. There are 3 main types of nerves. Those that carry sensation, so they bring what you feel back to the brain. Nerves that control muscles, so they send from the brain to the muscles, they're called motor nerves. They make your muscles move. And those that carry information to organs and glands, those are the autonomic nervous system. Okay? Sensation changes. What are sensation changes? Well, when there's a damage to the sensory fibers that results in the changing in sensation, burning sensation or nerve pain, tingling or numbness, or an inability to determine joint position, which causes incoordination. For many neuropathies, sensation changes often begin in the feet and progress towards the center of the body with involvement of other areas as the condition worsens. Diabetes is a common cause for sensory neuropathy. If you have movement difficulties, damage in the motor fibers interferes with the muscles of control and can cause weakness, loss of muscle tone or bulk. Sometimes cramps are a sign of motor nerve involvement. Other muscle-related symptoms include difficulty breathing or swallowing, difficulty or inability to move a part of the body, paralysis, falling, the legs buckle or you're tripping over your own toes, you can't pick your foot up and get it out of the way, a lack of dexterity, such as being unable to button a shirt, your finger dexterity is limited, lack of muscle control where your muscles twitch, and just loss of muscle tissue where the muscle atrophies or wastes away. So the autonomic nerves, they control involuntary or semi-voluntary functions, such as control of the internal organs and blood pressure. Damage to the autonomic nerves can cause abdominal bloating, blurred vision, constipation, decreased ability to sweat. It can cause diarrhea, difficulty beginning to urinate, dizziness that occurs when you stand up too fast, or fainting associated with a fall in blood pressure, feeling full after eating a small amount of food, feeling of incomplete bladder emptying, feeling where you go to the bathroom and you feel like you have to go back in right afterward. Impotence, nausea, vomiting, and unintentional weight loss. So, causes of neuropathy. What are the causes of neuropathy? Well, I hurt my back years or decades ago. I had a car accident 15 years ago. I was fine, but now I have problems. That can be a cause of peripheral neuropathy. It leads to scar tissue. Arthritis is another cause of peripheral neuropathy. Spinal stenosis, where the opening for the spinal nerves and also for the spinal cord is narrower in the spine, so the opening is getting smaller and smaller, and makes it stenosis and causes pain. Bulging disc. Statin drugs. If you're taking drugs for high blood pressure or cholesterol, that could be creating this. Diabetes, both type 1 and type 2. A poor diet. Genetics have a lot of effect on peripheral neuropathy. Statin drugs. What do statin drugs do? Statins inhibit the formation of cholesterol. Cholesterol is used to synthesize coenzyme Q10. And coenzyme Q10 is very important to generate what's called ATP, which is a fuel for the cells. And it's necessary for any cellular function, for any cell to function correctly. So if you have an inability to make ATP, you have a problem with your cells working. So therefore, older people have decreased potential to make ODP to begin with. So as they get older, the body slows down a little, so it creates more problems. Now, taking statin medication can suppress the ATP production to the point for which the neurons cannot maintain their electrochemical gradient. They're not strong enough to get that chemical across the barrier. So the firing of the neurons will decrease. And this is perceived by the brain and as numbness, tingling, etc. Statin drugs increases peripheral neuropathy risk by 16 times. A study from the Neurologic Journal of May 2002 that states that statin cholesterol drugs increase risk of peripheral neuropathy 16 times. That's 1,600%. Reason why, again, they block the coenzyme Q10 pathway. Diabetes and neuropathy. Insulin is a hormone produced by the pancreas to control blood sugar. Diabetes is caused because there's too little insulin or resistance to insulin, or both. Diabetes can lead to neuropathy. So, all chronic health conditions seem to have some common threads. Fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, restless leg disorder, rheumatoid arthritis, neck pain, hypothyroidism, insomnia, digestive disorders. They have these common threads, which is oxygen deficiency, neurological misfiring, metabolic imbalances, blood sugar imbalances, cortisone problems, hormone imbalances, anemia, autoimmune attacks, and brain imbalances. So we need to find the exact cause of what's going on here. Now, what happens with peripheral neuropathy, the brain is sending a signal to the nerve, and the nerve is not sending the signal along, because the nerve is not having enough juice to send the signal through across the transmitter. What leads to what happens is you have a misfiring, an overfiring of the mesencephalon. And when the mesencephalon is overfiring, there is a multitude of symptoms that begin to be expressed throughout the body. One is the sensitivity to light. Two is migraines, your heart could race, you have constipation and diarrhea, you have chronic pain and fibromyalgia, you have urinary tract infections, insomnia, and fatigue. But for those symptoms, you might have peripheral neuropathy. So what do we do that's going to make us different? Well, we're going to do a comprehensive neurological and metabolic workup. We're going to check your blood pressure. We're going to check oxygen saturation. We're going to check your heart rate rhythm. We're going to do a saliva pH. We're going to check your reflexes, your eye test, cranial nerve test, cerebellum test. We're going to check metabolic function. We're going to see how your blood sugar levels are, your adrenal function, your cortisol levels, your thyroid hormones, your cerebellar antibodies, thyroid antibodies, female hormone bodies, food sensitivities, and immune system. Let's make your immune function correctly, because an autoimmune disease can happen and attack the nervous system. Now, how do we treat this problem with peripheral neuropathy? Well, there's a few things we have to find out. We have to find out the exact cause of it. And there's two main important parts we have to take care of. Make sure the brain is functioning correctly and the neurotransmitters are moving correctly throughout the body. So the first thing we want to do is make sure you have proper food and activation for the brain. Because the brain needs those two things, fuel and activation. So fuel is glucose, which is food, and oxygen. So it's critical that we perform oxygen therapy on you to get that brain functioning correctly. The other thing is you have to activate. You have to turn on those nervous system pathways. So we do that by doing specific treatments that stimulate the nervous system. We use an upper body ergometer. We do specific unilateral adjusting. We do balance and proprioceptive treatments. We use vibration therapy. We use spin therapy. Anything that we can that's going to stimulate specific pathways to get that brain functioning correctly. All cases of peripheral neuropathy are a combination of both neurologic and metabolic problems. So we have to do both neurologic and metabolic treatments to get you feeling better. So when the brain hemispheres are misfiring and there's metabolic complications, we need to get everything back in order. So we have to get that brain firing again correctly, so it sends the correct signals to the different pituitary gland, thyroid gland, down to the adrenals, get everything functioning well. And we'll get your cortisol levels balanced out, we'll get your blood sugar balanced out, and your hormones back balanced again. And with periodic testing, we're going to know if we're on the right track, and we're going to get everything back to the way it should be, and because we're going to treat you as a whole person. We don't just treat the peripheral neuropathy. It's not like, okay, you got burning feet, let's just take care of the feet. We're going to take care of your whole body, from your head to your toe. And we put all the pieces of the puzzle back together and get you feeling good, and that's what you want to do. So, if you have any of these problems, please give us a call. If you know anybody who does, give us a call and get out as much information we can to you and see if we can help you out. Thank you very much. Okay, so I do have some commitments and some ground rules I want everybody to follow, and I need everybody to follow and understand to make everyone's life a lot easier. There's 3 rules for acceptance of your case. First, one, you must be willing to make serious life changes. This is not going to go away. This is not, okay, let me give you a couple of vitamin supplements, do a couple of adjustments, and do some minor treatment that's going to get it better. You have a serious, most likely an autoimmune disease. It needs to be taken care of, and it needs drastic changes in your life to get it fixed. Two, you have to take responsibility and accountability for your health. The government is not responsible for your health care. Your health insurance is not responsible for your health care. Insurances do not cover most of the treatment we do. They do not cover the testing we do. Okay? So it's very important that you take the responsibility for your health. And number three, this program is not inexpensive. However, though, if you could afford $200 a month, you could afford this program. The program is very important. The testing is very expensive. It needs to be taken care of to get the specific cause of your condition so you can get better. If you're not willing to follow any one of these 3 ground rules, I'm not going to take you on as a client or as a patient. So it's very important for you, for your own health, that you follow these 3 ground rules. Now, I need you to ask yourself, on a scale of 1 to 10, how serious is your illness? How is it affecting your relationships? How is it affecting your work? How is it affecting your ability to enjoy life? How serious are you about eliminating your illness? And due to time constraints, I only accept a limited number of people who are really dedicated and focused on getting themselves better. Like I said, I only take 5 people per month. It is very time consuming, a lot of work on my part to help people out. So I can't take everybody who walks through the door, unfortunately. So please, if you think you're a candidate and want to change your life, give us a call. 303-660-2668. Thank you and have a good day.